Did you know that the uterus can actually be laying in 4 different positions? The 4 different positions are anaverted, retroverted, anaflex, and retroflexed. The normal representation of a uterus is usually in the position of the anaverted. However, in some cases during pregnancy, the uterus can be rotated. 50% of female uteruses actually lie in an anaverted and anaflex position. For example, a woman with an anaflex uterus may experience an increased pressure in the pelvic area. Other more serious conditions when it comes to an anaflex uterus can be pain while inserting tampons, pain while with intercourse, and pain with menstruation. So during these both tilted uteruses like anaflex and retroflex, fertility is not often affected. However though, it could add more stress in the lower abdomen and back during pregnancy. The uterus can also be retroverted, which means that the uterus is tipped backward at the cervix. 1/3 of all women actually have a retroverted uterus. Again, this type of positioning generally does not cause any serious health issues, but it may cause an increase in back discomfort during the pregnancy. One of the biggest symptoms of a retroverted uterus is actually painful intercourse, and this is because your uterus is literally positioned different than your body. When the uterus is retroverted or retroflexed, or in a tipped position, it may cause some pelvic pain and some difficulty inserting tampons. Now, a great way to actually manage if you have an anaverted or a anaflexed or retroflexed uterus is using the Webster technique. Now, what is that? So the Webster technique is actually a great way to manage pelvic pain. That is just a gentle chiropractic adjustment to the pelvic bone. It allows the pelvis to function properly during pregnancy. It helps reduce soft tissue tension, which causes a better environment for the baby during a pregnancy. The Webster technique is actually really helpful in providing relief for lower back pain and sciatic pain, which is something that usually pregnant women actually encounter. So there it is. Those are the 4 different positions that a uterus can be found in. Do you know your position? And if you don't and you want to know, you can simply ask your gynecologist the next time you have a visit to let you know what position your uterus might be in.